All right, we're going to have a little bit of fun with Healthline 3 today because when we look good, we feel good, right? Well, it's something women talk about all the time, how to keep our skin looking younger longer. But now more men are taking an interest in their appearance, including our own John Fredericks. Years of playing golf and our hot son have aged John. And in today's Healthline 3, even Jordan agrees it's time for Dad to get a makeover.
John had no idea what we were going to do to him. When he came in here, we just said, you're going along for the ride.
John's treatments alternate every week between a photofacial, which you'll see later, and this microdermabrasion, which takes the dead skin off.
It really causes the photofacial itself to do a better job by exfoliating those top skin cells, and then it allows the photofacial to get down a little bit deeper.
John's problem? Red, blotchy skin, broken capillaries, and brown spots from years in the sun.
Every once in a while I'll pull out a tape from when I first got here to now, and the difference is just, it's scary.
The microdermabrasion is a deep exfoliant that Don says leaves the skin looking more hydrated and healthy.
I can feel a little tingling, I guess it's like a little sandblasting effect thing, but what I feel more is it's almost like a little tiny mini vacuum cleaner.
Dr. Giselle Anson is the Las Vegas plastic surgeon overseeing John's care. She says treatments like this one should be a regular part of your plan to ward off aging.
Their microdermabrasion are like glycolic peels, using good products, a retinol or retin-A, and a good topical vitamin C. If you do those things and wear sunblock, you will do very well.
But the microdermabrasion won't take care of the red and brown spots on John's face. That's a job for the photofacial.
Be sure you tune in today to News 3 at noon to see the difference.
You'll see the photofacial tomorrow. Don alternates between the microdermabrasion and the photofacial every week, and tomorrow on News 3 you'll see how the photofacial works, why John says it smarts a little bit, and find out just how many men are lining up for the procedure. Yesterday on News 3 we told you about more men taking an interest in their appearance, and we showed you how our own John Fredericks is getting help for the brown and red blotches the sun has left on his cheeks. Well, yesterday you saw how the microdermabrasion helped prepare John's skin for the photofacial. And in today's Healthline 3, see how the photofacial treatment could actually erase years of sun damage. We caught up to John 1 week after his microdermabrasion for his photofacial. It's an intense pulse of light that feels like a rubber band snapping on your face.
This is the most sensitive area. Anywhere I shave is pretty sensitive.
But John thinks the irritation will be worth it.
I always kind of try to give people realistic expectations as to what results they're going to do. I think it works very well on sun-damaged skin. I think it works really well on rosacea, hyperpigmentation. It evens that out.
But photofacial is not a miracle.
Photofacial, I think, is very effective for sun damage. That's all it does. It's not going to make wrinkles go away, despite what you might hear. It improves broken blood vessels from sun damage, rosacea, brown spots from sun damage, pore size. I think it's very effective for those things.
Dr. Giselle Anson is one of the most respected cosmetic surgeons in Nevada. What is the miracle right now in your field?
There is no such thing. There is simply no such thing. Everything has a pro and a con. And it's unrealistic to think that there's ever going to be anything that is perfect, although Botox comes pretty close.
Dr. Anson is overseeing John's treatments and more male patients every day.
I think with men, they have the added burden of feeling that they have to stay young for their business, to stay in the game. They have to compete with younger people, and so they want to stay looking as young as they probably are fit.
Men now make up about 25% of her business for small procedures like the photofacial.
I actually have had people comment. I think a lot of times it's something that's so subtle that, unless you were living with a person day to day, you probably wouldn't notice. But I hope they do.
And we have. Kendall was just saying he saw John Fredericks in the newsroom today and noticed a significant difference in his skin. One side effect of the photofacial, though, is that it slows down hair growth. So men, if you want to grow a mustache or a beard, you would want to avoid the photofacial just in those areas. The combination treatment John is on runs 12 weeks at a cost of about $2,000. So the big question is, what can you do for less? First, stay out of the sun. Don't smoke. Use good skin products with retinol or retin-A. Use a good topical vitamin C on your skin, and occasionally, Dr. Anson recommends you have the microdermabrasion or a light glycolic peel just to get rid of that old dry skin. Dr. Anson says small, simple maintenance when you're young will keep you from ever needing major cosmetic surgery as you get older.